Welcome to the Clinical Psych Lab. In this module, you'll refresh your knowledge of the abnormal psych market and the Ray abnormal psychology text. Let's start with a quick refresher on the abnormal psych course. This course is part of the clinical psychology subdiscipline and studies unusual behaviors, emotion, and thought, which may or may not be understood as precipitating a mental disorder. It's offered out of the psychology department and taught at the undergraduate and graduate level. Common course names include abnormal psychology or psychopathologies. This is a popular course with about 350,000 students taking the course each year. Ray is an abnormal psychology text that helps students make sense of the current changes in the DSM-5, providing students with exposure to real clinical settings and encouraging critical thinking with multiple opportunities throughout the chapter to check for understanding and practice the concepts. Before we refresh on the updates to this edition, let's review the book's approach and why Ray is unique in the abnormal psych market. The biopsychosocial model is a framework that states that interactions between biological, psychological, and social factors determine the cause, manifestation, and outcome of wellness and disease. It refers to the idea that the mind and the body are inseparable entities. Ray offers students a glimpse into how psychopathologies are experienced in our everyday lives through its lens feature. The cultural lens feature speaks specifically to the new emphasis on cultural competence as part of diagnosing and treating patients. You'll want to ask your customers how they cover social and cultural issues in their class. So what is the DSM-5? The Diagnostic and Statistical Manual offers standard language and criteria for classifying mental disorders. This book defines the way that mental disorders are viewed in clinical practice, research, policy, legislation, funding, and the way we view mental conditions in society. Ray's Understanding Changes in DSM-5 feature talks about the changes in the diagnostic criteria. An instructor will find this important because it's a tool clinicians will use throughout their career. A great discovery question to ask would be, how does your current text help your students understand the DSM-5 in diagnosing psychopathologies? Students need to understand how real people experience psychopathologies to understand how to work with them and treat them. Ray does this through cases presented in the book. Another way to offer students a look into psychopathologies is through assignable video we have in our Sage course pack. To explore this need, you will want to ask your customers how they bring real-life situations into the classroom. The digital package that comes with this book is a little different from what we typically do. You might say it's abnormal. Along with our standard Sage Edge site, including lots of great study and practice opportunities for students, we're also offering a Sage course pack for this book. The course pack is where you'll find assignable Sage video resources as well. Now for the part that breaks the rules, so to speak, is that this book does not have an IEB. Instructors can still get a web PDF version, but there's no interactive ebook with this edition. Keep this in mind so you don't overpromise on campus. Ray's abnormal and has a course back with no IEB, which is abnormal for Sage. Let's take a look at the competitive market for Ray. You may have noticed that the abnormal market is pretty crowded. We also want you to notice that Ray falls close to the middle of the competitive spectrum. This opens up lots of opportunity for you because Ray's 16 chapters will appeal to users of brief and comprehensive books. At the lower end, you will have opportunity with Kearney and Naveed users, since these books are out in new editions. At the mid-level, you may have some opportunity with Kring and Altman's users, since there's no indication that these books will be revised. And at the higher end of the market, Rosenberg, Barlow, and Hooley Butcher are major targets since, like Ray, they emphasize the biopsychosocial approach. We've also learned that Barlow Durand and Hulu Butcher have new editions coming out for 2017. And remember, when you think of Ray's Abnormal, think of Abby Normal. Here's a quick refresher of all the titles we have to offer in clinical psychology. Lead with Ray's Abnormal Psychology text with its person-first biopsychosocial approach for the popular Abnormal Psych course. We also have a comprehensive introduction to child and adolescent psychology, a more specialized version of the Abnormal Psych course, and this is with our revision of Weiss. In addition to these great core texts, we have 3 casebooks for you to offer instructors, allowing them to give their students exposure to experiences based on real clients and a look at the clinical experience. The Levy Casebook offers a holistic view of the clinical experience from intake to treatment and follow-up. This book is a great bundle item for Ray. The other 2 casebooks we have are for the child and adolescent course. First, we have Wilmshurst, which offers real-life cases covering assessment, diagnosis, and treatment practice of childhood disorders. We also have a custom casebook written by our author, Bob Weiss, including over 50 brief cases for each chapter in his core text. Both of these casebooks would be great bundle items for Weiss, depending on the instructor's needs. Lots of opportunity to practice asking, what else do you teach? Ray has useful features and a great story to share with your customers. But do you know how to tell the Ray story so that it matters? Understanding the personal and task motives will help give your story more meaning. What are some of the personal and task motives you encountered while selling Ray in the spring? We want to know. Submit your story to Sveta Mihailov prior to the sales meeting. Thanks for listening. See you in Ojai.